Can I just say I'll be glad when we get to a point in veterinary medicine where we are not so judgmental to our colleagues about, what they decide to practice or what pets they decide to work on. Like, why does everybody or a lot of the population in the veterinary field feel we have to see or work with every single individual type of animal out there? Like, we went into veterinary medicine for a reason, and we have a reason for that, and we decide what pets we want to work with. Like me, I just want to work with cats and dogs. That's all I want to work with. I don't want to be around no damn horse. I don't want to be, I'm terrified of horses. So I got through vet school, dealt with my horses, and I'm done.
Thank you for starting this discussion, Dr. Eccles. I think it's one that we should have. I completely respect your decision to only see dogs and cats, and honestly, I feel like that's becoming the norm. More and more veterinarians are narrowing their scope, not just by species, but by the degree of care they're willing to provide. More and more general practitioners are now avoiding surgeries beyond just spays and neuters. They're avoiding things like advanced dentistry, ophthalmic procedures, advanced imaging, and other procedures that general practitioners used to provide. Instead, it's all being referred out. Now, don't get me wrong, the gold standard is referral to a specialist. That will always be my first recommendation. But the reality is that it isn't practical for most families. Specialty care is often hours away, and the costs, they're astronomical. I know I wouldn't be able to afford some of the estimates I have seen coming out of referral centers. And where does that leave our patients, our communities, the animals we swore to advocate for? It leaves them without access to care. It leaves families choosing between suffering and debt. Not because the medicine is impossible or even because it's that hard, but because we're saying, I won't do that. So here's my plea to my colleagues. Step outside your comfort zone. Keep your skills sharp, your mind open, and your heart full. Offer what you can when you can, and document everything thoroughly. Be honest with your clients and tell them, I've never done this before, or I've never seen X before, but I'm willing to try. Because sometimes you're going to be the only thing standing between that pet and euthanasia. The truth is, these animals need us. Their families need us. And without us, they're losing both advocates and access to care. My personal belief is that veterinary care should not be inaccessible or unaffordable. And if we keep going down this path that we seem to be taking, it's going to be. For the love of our patients, for the love of our job, let's not forget why we became veterinarians in the first place.